when the most important thing about preventing oral disease, cavities and gum disease, is brushing the teeth twice a day, morning and evening, and trying to floss them once a day as well. So today I have brought some different adaptable products. When you're still able to brush your own, you can use something like this. When you're brushing someone else's teeth, you can use a regular toothbrush or an electric. When you're using a manual toothbrush, you can start by brushing the biting surfaces, and then place the bristles above the gum line and roll down at least 5 to 10 strokes in each tooth area, and work your way around, doing the entire upper arch on the outside and then the inside. Think of it as a circuit, then you won't miss any areas. On the lowers, you're going to place the brush on the gum line and roll up, working your way around slowly. Some people tell me it's really hard to flick on the inside of the bottom teeth, so there you can do short scrubbing right at the gum line and you should remove the plaque well. So, Heather, do you want to go ahead and use a regular toothbrush? I'm just going to have you use this one and try that rolling stroke and see how it feels.
I'm glad, Jane, you said this one rather than the purple one over there.
That just leads into a lot of other things about a big mouth, but we're not going to go there. He's got a good adequate mouth there. Good. If you find the flicking motion too difficult, you can do small circles as well. And you're still going to disturb the plaque fairly well. That's great. A much easier technique is using an electric toothbrush, and I highly recommend it. When using an electric toothbrush, the technique is a little bit different. You're going to place the brush half on the gum and half on the tooth. Wait about 2 seconds. Let the brush do the work, and then slowly move it down. Move to the next tooth, count to 2, and slowly work it down. It's wonderful, very effective, and a lot less work. So Heather, you go ahead and try that with Kelvin. Hold it and draw it down. That's it. The electric toothbrush really does a good job of removing plaque. It's very comfortable for the client, and Kelvin tells me this is his favorite way to have his teeth cleaned. Besides the brushing, that takes most of the plaque off. There's still a lot of plaque caught between your teeth, which is where cavities and gum disease usually start. Flossing is important. There are a couple of possibilities. This is a type of floss handle. You have to manually wrap the floss on it. I'll take it off. You wrap it around the button, across the top, and down the other side. Then you can just hold it and gently push it down between the teeth. This is one possibility. Another one is this one. Much easier to use. The top can be taken on and off. Once you've completed your whole mouth, the top should be taken off and thrown in the garbage. To use this floss handle, you place it between the teeth and gently push down until it's gone through the tight part, and then gently rub up and down around the neck of the tooth and out again. This will disturb the plaque caught between the teeth. It is so much easier than manual flossing. Something to remember, at different stages of ALS, the client clenches and grinds sporadically. It's safer to use a handle to reach those back teeth than to put your fingers right inside the mouth. So, Heather's going to give it a try. Excellent. Sometimes what you can also do when you're flossing, when you're pushing down, is support with your hand under his chin. And that'll give him more support, and it's actually easier for you. It gives you some resistance when you're pushing down. So that's great. We've already talked about the tongue cleaning, flossing, and brushing. Those are the basics, and those should be done every single day to have good oral health and prevent disease. Many patients have asked me some really good questions that I just want to talk about briefly, and hopefully they'll be of help to you as well. Some people say, my gums bleed when I floss and brush. Am I doing something wrong? Am I hurting myself? No. Bleeding gums is a sign of gum infection or plaque buildup. Continue to floss regularly. If the bleeding stops in that area, that's great. If it doesn't, you need to see a dentist or dental hygienist and assess whether that is a sign of more advanced gum disease. My family member with ALS doesn't eat anymore. They're fed through a tube. Do I still have to brush the teeth? Yes. Plaque builds up constantly, all the time, whether we eat or not. So brushing and flossing is still important to maintain their oral health. Another question I've been asked, how about antibacterial rinses? What if I rinse really, really well? Do I still have to brush? Yes, you still have to brush. Plaque is a film that sticks to the teeth. It's like a fast-flowing river with rocks inside that have moss on them. The fast-flowing river will not take the moss off the rocks. A brush would. Plaque is similar. It has to be mechanically removed to be effective and to clean the oral cavity. Thank you for taking the time to view this video, and I hope this information is helpful to you and your family members and your caregivers. I wish you well on the journey with ALS. And thank you, Heather and Kelvin.
Thank you.